Well, my impression of Providence St. John's when I first arrived is it's an organization that is made up of caregivers, but they're all part of a family. It had this really calming, caring environment that, frankly, I've traveled around to a lot of hospitals in my career, and there's something special here that really excited me to be a part of the family here at St. John's. So, yeah, it's that kind of feel.
Welcome to St. John's. How may I help you?
St. John's is the community hospital for so many. It is what we call the diamond in the rough. We say this because so many of our families and the patients who keep coming back depend on us.
Epic will definitely improve how we do business. And when I talk about business, it's not so much business, it's our service. It's our service to the patient, our service to the community. But in the final analysis, we're striving to be the best place to work, the best place to practice, the best place to receive care, and the best partner. And Epic's going to help us achieve that. One record for each patient. And the nice thing about it, if you remember on the paper charts, you had to wait for somebody to finish the chart before somebody else could have it. Now you can have multiple people accessing the chart at the same time. So it's better, better responsive access to the chart.
Hi, good morning. Welcome. My name is Yesenia. Welcome to Providence St. John's Health Center. I'm from admissions. I'm going to be taking care of your pre-registration. Do you have your ID on you today? May I have it, please? Thank you so much. Please take a seat. We will be calling you very shortly. Okay? Thank you very much.
AIDED is a model developed by the Studer Group that really gives you a roadmap for managing your patient and family interactions. It's both simple and powerful all at the same time. AIDED is really a reminder to all of us to always do certain things with every interaction, such as greet somebody, acknowledge them, introduce yourself, tell them who you are and what do you do. The D in AIDED is to talk about time frames, because when we don't talk about time frames, it creates anxiety for people. So talk about the time frames and how long things may take or when they might happen. Explain things to the best of your ability, which gives you the chance to answer questions and really do a thorough job of communicating. The T in AIDED is great because it's the thank you. When we thank our visitors here at St. John's, we show that we appreciate them.
When I think of Epic and I think of a computerized medical record, I think of quality. I think of a quick turnaround with patient care. Not that we haven't been quick, but it's going to be quicker. It's going to be an asset for every single employee here at St. John's. May it be a person at the bedside, may it be anyone in any of the other departments that are ancillary. It is going to be an asset to have that at your fingertips.
There's certain behaviors that show to somebody you have a positive attitude. Eye contact, a smile, asking a question, and listening carefully are all things that show a positive, good attitude, and is critically important to creating a positive patient experience. Of course, in creating a positive patient experience, it's important to let our patients and families know that confidentiality is important to us and that we're using the system to help keep their medical record safe and secure.
So I'm going to be here for just a few minutes. We're going to go over a few things. So how did you sleep last night?
Very well, thank you.
Good. We're going to start you on a clear liquid diet this morning. And did you have any nausea last night?
No.
Okay, good. So I want you to I'm sorry. We'll worry about that later. We're getting a new computer system, and we're all kind of figuring out how it works.
Hello,
Hello.
Mrs. Corson.
Yes,
How are you?
much better, thank you.
Great. I'm Sam from the lab, and I'm here to take some blood sample from you today. Is everything going okay with you?
Yes.
I'm just going to scan your wrist. Thank you. How's your day going?
Much better, thank you.
Excellent. Okay. Now, this procedure will just take about 5 minutes. I'm going to get everything ready. Now, I'll just prepare your arm, and I'll get the blood sample, and we'll be finished in no time.
From the physician standpoint, I think there are a couple of challenges. The first is learning a new language, and the second is really how it impacts patient flow and throughput. I've had the experience in my office of an implementation of a different electronic medical record system, and certainly there were challenges. There are frustrations learning the language, learning the flow of the language, and sort of how patient information is input into a system. Once that's sort of established, however, the fluency, it really becomes the challenge.
I'm sorry, Miss Corson. We've got a new computer system and I'm not making eye contact with you, so I apologize.
We're all going to learn more about the triangle of care, but it's a concept that teaches you to position yourself and the computer, since you're using Epic, and the patient in a triangle so that you're not behind the patient when you're doing your Epic work.
Oh, hi, honey.
You look great. How do you feel?
Oh, I'm so much better. I'm so glad we came here. They've been so wonderful.
How did everything go?
Very well. Great experience.